diabetes is actually a really significant issue. A lot of people struggle with it. The numbers of diabetes are certainly been rising here in the US and other parts of the world. Diabetes affects the eyes significantly. Not only does diabetes increase the risk for things like cataracts, but diabetes affects the blood vessels throughout your body. And the retina in the back of the eye is one of the most highly vascular organs in their body too, next to the kidneys and the brain. And so that's why when somebody is diabetic, they should be recommended to see an eye doctor at least once a year so that they can have their eyes checked. Because while your doctor, like your family doctor and endocrinologist, they can do blood samples and see how glycated or how much glucose is in your blood, they really can't see end organ damage, or unless you have like diabetic foot ulcers or you have some sort of neuropathy. But we can look inside the eye and we can actively tell if you're bleeding inside of the eye. And that can obviously cause deterioration in vision, but it helps us communicate to whoever's managing diabetes if it's being well controlled or not, or how the body's organs are responding to medication or treatment. And so I think it's just really important for anybody who is diabetic or you have a diabetic member in your family to make sure they are seeing an eye doctor on a regular basis. And to really, take dietary and lifestyle changes seriously. We continue to see research that if you're able to lose weight, stay more active, be more conscious about what you're eating, especially heart-related things, because if you're diabetic, your risk of high blood pressure, cholesterol, vascular changes to your heart and your brain, eyes and brain, definitely are all increased. And so if you catch it early enough and you're aggressive about managing it, making those lifestyle changes, we can see people go into remission of diabetes now, especially if it's type 2, obviously. But definitely diabetes can affect the eye pretty significantly. So we can always dive deeper into that if you'd like, or if people want, they can also consult some of the things I've published over on YouTube on understanding how diabetes affects the eye.
As you talk about that, I'm curious, how early can you detect diabetes in the eye? Because one of the challenges with type 2 diabetes is that it can take up to 20 years to fully manifest in the body. And there can be, not can be, there actually is metabolic changes, insulin resistance that happen in the background over that period of time, causing all kinds of damage. So if somebody like you early on can see those changes in the vessels of the eye, that would be huge for a lot of these people that aren't going to catch it.
You're right. Unfortunately, still the body has done a really amazing job evolving and knowing, hey, we need to protect these organs as much as possible until it's just we can't do it anymore. So people are often, even after they've been diagnosed with diabetes, it depends on how severe their diabetes are or how long it's probably been going on even before diagnosis. But it often is some time before we start noticing bleeding changes inside the eye. At that same time though, I've been the doctor to more or less diagnose diabetes, or at least I diagnose hemorrhaging, and I send a letter to the family doctor and I order blood work saying like, bleeding in the retina is consistent with diabetic retinopathy. Check for these, I submitted the blood work, check for this, manage. And it's always great getting letters, even the family doctor saying, thank you for catching this. These are often patients who don't see the family doctor on a regular basis. They just come in to get the glasses and then I find this. We do see, because we do have access now, not every eye clinic has this, but there are electrodiagnostic testing. So we have what's called electroretinograms. In our clinic, where I practice here in Virginia, has one. Where I used to work in Minnesota has one. But these can also detect function of the retina cells. Even though your vision may be 20/20, we can detect the electrical signals that are going between the retina and the brain. And for people with diabetes, if there's not enough blood flow, not enough nutrients that are getting to the retina, we can see dysfunction in those electrical signals. And so as people get better control of their blood glucose and they have better metabolism, we can see improvements in that electrodiagnostic testing. I think the industry isn't quite there at using electrodiagnostics as a sensitive tool for diabetes specifically, but it is something that some clinics can have access to and utilize. But largely, most of the time, by the time we see diabetic retinopathy changes in the eye, it's already been going on for, like you said, a decade or so. It does depend on how extreme it is. And it's unfortunate because it affects so many people, right? I think the current statistics in the US is like 11% of the population truly has type 2 diabetes, but then like 40% of us have pre-diabetes and like 60% of the population or more is insulin sensitive, insulin insensitive. So there's, the statistics are kind of staggering. And thankfully there's great resources like what you're putting together to try and reach people and give people at least a beacon of hope of like what they can do and getting information about how to take better care of their life. So thank you.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
Diabetes affects the eyes significantly. Not only does diabetes increase the risk for things like cataracts, diabetes affects the blood vessels throughout your body. And the retina in the back of the eye is one of the most highly vascular organs in your body.